March, and this is the month that is Colon Cancer Awareness Month, and we're talking about that right now with Dr. Kyle Dunning. He is from the Ogden Clinic. Let's start from the beginning. Dr. Dunning, what is colorectal cancer?
Colorectal cancer is cancer of the colon and rectum in the intestinal tract.
What are the symptoms? Do you have any warnings?
Early colon cancer really doesn't have any symptoms, and that's the importance of screening. Later stages of cancer can have pain or blood in the stool or weight loss, but most people really don't have any symptoms at all.
Is this one of those cancers that is preventable?
Absolutely. A lot of colon cancers come from polyps, and if we remove the polyps early, we can prevent people from getting cancer at all.
I think you hear the word polyp, and a lot of people don't know exactly what that is.
Polyp is a small growth in the colon. It looks like a mole on the skin.
If mom had a polyp or dad had a polyp, are you more likely
Yeah, that's
to have
very
a polyp?
important. Family history is a strong predictor, and if someone in your family had colon cancer, you should definitely talk to your doctor about getting screened early.
All right, we talked a little bit earlier about maybe things you can put in the cart at the grocery store that can help prevent colon cancer.
Sure.
What would that be?
High fiber diet, lots of fruits and vegetables, is associated with a lower risk of colon cancer. Obesity is associated with a higher risk of colon cancer, as well as smoking.
All right, let's talk about the screening, the colonoscopy. Why aren't we doing them?
A lot of people are embarrassed or they don't understand the process. It's a very simple process. We have a prep that people drink the day before, and the colonoscopy is performed under sedation so you don't feel anything, and most people are home within an hour after the procedure.
And that prep just cleans you out to get you ready for that procedure, which doesn't work, right? Unless you do the prep the night before. I've had a colonoscopy, and I will tell you, it was so much easier than I thought it would be.
Most people really come out stating that it wasn't as bad as they thought it would be and would have done it earlier if they'd have known how easy it was.
Who should get screened?
Anybody who's 50 years or older should definitely get screened. If you have a family history or personal history of other types of cancers or colon cancers, they should start earlier and talk to their doctor about those risk factors.
Is colon cancer more common in men or women?
It crosses all races and both sexes, so there's not really any higher group, but everybody should be screened.
Is a colonoscopy the best way to screen for colon cancer? Or are there other ways to screen?
There's some other tests that have been around for a while, but colonoscopy is the gold standard, is the best. And it's also a part of the treatment. If there's a polyp there or a small tumor, it can be removed at the time of the colonoscopy.
Yeah, that's what I was going to ask you. What is treatment like for colorectal cancer?
Early colorectal cancer sometimes can be resected through the colonoscopy. Others need surgery, and more advanced tumors need surgery and chemo and radiation sometimes.
But if you catch this early, very preventable?
Right, and the survival rate of early colon cancer is very high. Late stage colon cancer, when patients have symptoms, is much harder to treat.
So the bottom line is you can do it. Right? You can get your colonoscopy.
Absolutely.
You can do this and you can prevent colon cancer. Such a great time to talk about it during Colon Cancer Awareness Month. And if you have any questions, please call the Ogden Clinic. That is their website. We will link you from ours. Go to goodforutah.com/midday. That's where Dr. Dunning is. Thank you so much for stopping by the show.
Thanks for having us.
Good information. We'll be right back.